to community engaged research. And so you're going to get to hear a little bit from all of us of work we've done on the continuum from kind of community engaged to CBPR, community-based participatory research. So without further ado, and I'll let each of the panelists introduce themselves as we go through to save some time, but I'm going to turn it over to Dr. Gretchen Macy, who's going to get us started, and then you'll get to hear from all of us. So hope you enjoy this. Gretchen?
Thank you, Dean Basta. I'm going to share my screen. Okay, well, as Dean Basta mentioned, I'm Gretchen Macy. I'm Associate Professor in the Department of Public Health here at WKU. I'm also one of the co-assistant directors for the Center for Environmental and Workplace Health. And today our group is going to discuss how we engage students in the community in focused research, training, and outreach. I'm going to begin by just giving a brief overview of the Center for Environmental and Workplace Health. Our center was the first applied research center established in the College of Health and Human Services here at WKU. Our proposal was approved in August of 2016, and the ribbon cutting, which you see the picture here on the slide, was actually in fall of 2017 in conjunction with the Chamber of Commerce. The vision for the Center for Environmental and Workplace Health is to be a leading applied research center in both environmental and workplace health and occupational health and safety. And the focus is on Kentucky and the surrounding region. We really want to provide students an opportunity for applied research in order to help them meet the challenges for a safer and healthier community. The mission of this center is to help address local and regional challenges, again, in environmental and workplace health and occupational health and safety. And we want to do this through initiatives in research, education, outreach, and service. And as we move throughout the presentation today, we're going to highlight some of these initiatives and different projects that we've conducted in order to hit on each of these areas. And again, the focus is in engaging students and being able to equip students with the ability to transfer the knowledge that they gain through these initiatives and putting it into practice to help them build stronger and healthier communities. The Center for Environmental and Workplace Health has two main research focus areas. The first is in hazards in the human environment. So whether these are in workplaces or in the larger community or even in specific occupations. Later in the presentation, Dr. Richie Taylor will discuss firefighter health. This is one of our specific areas where we've looked at different health hazards that are specific to firefighters, and we've conducted research and community engagement on how to help improve health conditions specific to firefighter populations. The second research focus area is on broader environmental issues that impact some form of human health. So we've conducted research and engagement in stormwater management, air and water quality, and this is really a broad research focus. And so we welcome collaboration on any of these research and engagement efforts, and we want to open that up. So if you have research ideas, whether within the college or the broader community, we really want to open up the opportunities for collaboration, and they are vast with our research focus areas. Okay, now that I've gone over just a brief overview of the center and what we do in the Center for Environmental and Workplace Health, I'm going to turn the presentation over to Dean Tanya Basta, the Dean of the College of Health and Human Services, and we're very fortunate to have her. She's an expert in community-based participatory research, and she's going to walk us through that.
Thank you, Dr. Macy. All right, so everyone already knows who I am, but just got introduced. Going to talk a little bit about community-based participatory research, also referred to as CBPR. So if you want to go to the next slide, that'd be great. Okay, so just to give a little background, we throw a lot of terms around related to community engagement, community-based research, and CBPR. And so I wanted to just kind of discuss the differences between all of these. So community engagement, we talk about that all the time. That doesn't have to be necessarily related to research. It can be certainly just engaging with community members and providing either an educational session, or there may not be any research involved at all. It could just be providing information to community members or at a particular agency, all the way then to community-based, or we'll start with community-based research, which is really collaborating with people in the community, whether through an organization or agency, to collect data from a particular group of individuals. And this is where I would say the majority of my research is from community-based research on, having done a lot with individuals living with HIV. It's not an easy population to find or to sample. And so working with HIV related organizations to be able to access that population is really important. So a lot of my research certainly starts in this realm. And then CBPR Lite, which I like the CBPR Lite. This is probably what most of us do in when we're out in the community, is having partial involvement of some or all of the study with the community. And so it might be that instead of total community-based participatory research where you're complete equals in the research process, it might be that the academics are driving the study questions and the research design, but they might be helping or have community members helping in data collection. Especially, this is what we did a lot and when I lived in Appalachia. No matter how long I lived there, 13 years, I was still always seen as an outsider. And so a lot of times I hired people to go collect data who were from rural Appalachia, and they were able to have that insider perspective that no matter how hard I tried, that I'd never be seen as an insider. And so that was really helpful in trying to collect data from certain populations, especially when you're trying to gain trust and access. And then total CBPR is really challenging, and that you really, the academic side and the community side are complete equal partners. There should be no preconceived ideas when you go into a community. You might go in and say, okay, what are the health issues, or what are the issues in this community that are problematic to all of you, instead of going in and saying, okay, I know that you have high rates of teen pregnancy, how are we going to fix this? And then designing the study together, collecting the data together, even analyzing it together and disseminating it. You know, we had community members who did go to the American Public Health Association and help disseminate the information, not just at professional organizations, but also then back in their communities as well. So that's the continuum. And so here we go, CBPR. It was developed in public health research, and probably not surprising. Years ago, we were really not good in public health, right? We'd go into communities and say, here's your problem, how are we gonna solve it? And we didn't understand why we were failing. And so this was a way in which researchers were able to go in and say, okay, what is of an issue to you? And how can we help solve this together? And so it really embraces that collaborative effort among the academician and the community members to work together in the entire process. It's time consuming, it's difficult to do. And so a lot of people don't want to take on this type of research because unfortunately the publish and or perish timeframe doesn't always allow for the relationships that need to be built to do a true CBPR study. It takes a lot of years often to get that done. And so a lot of times this is work that is done once researchers get tenure and promotion. And the other thing I want to point out is CBPR is not a research design or method, but an approach, and a collaborative approach. You still use qualitative and or quantitative research methods. It's just, so it's not its own method, it's just an approach to designing studies. Okay, next slide. Some of the principles, I'll go through these fairly quickly because I know we have a lot to cover. One of the biggest things is the community. You want to identify a community that identifies itself. So, we can slice and dice that any way you want. Bowling Green, Warren County, women ages 18 to 24, smokers, non-smokers, LGBTQI. So however a group identifies as a community, that is considered the unit of identity. We don't want to go in, just like I said, we don't want to go in and point out people's problems. We go in and say, how can we help fix whatever you perceive as an issue, and what are the strengths and resources that you all have in this community to try to solve the problem. Collaborative partnerships, we already talked about this in all phases of the research. It should involve knowledge generation for both sides. So the community should be learning, the academicians should be learning, and it should be a mutual benefit to everybody involved. instead of traditional research where a lot of times, right, the researcher goes in, they collect their data, they leave, they never tell the participants what the results were, they never come back and say anything again. And so what is that, how is that helpful to that particular community? So there needs to be some two-way learning. And that kind of goes into also co-learning and empowering people to figure out how to solve their own problems and to work with academics to do that. And certainly to try to attend to social inequities, but also health disparities as well. It's an iterative process. And so you might, it's not like a traditional research where you might go in, you know, here's my research questions, my hypothesis, that's all done kind of a priori. You go in, collect your data, analyze it, disseminate it. You might go in this thinking that's one thing one week, and then the next week you've got to make a few changes and you backtrack a little bit. So it's a constantly evolving process, and it's not, it's more muddy than a traditional research approach, but that also makes it fun. And you look at this from a social ecological perspective, you know, looking at the individual factors contributing to health issues all the way up through community and society level as well. So making sure you're not excluding any of those levels throughout your analysis. And then finally, making sure everybody's involved in the dissemination. And I'm going to share that here from a project that I worked on many years ago in graduate school, but I think it's still really a cool project. Okay, Gretchen. So when I was years ago, a master's student, MPH student at Indiana University, I was a graduate assistant on this project. And the project itself was called the Rural Health Outreach Project. And it was to evaluate, we were evaluators on a grant to increase access to healthcare for the Amish and the elderly in Southern Indiana. And this was an offshoot of that evaluation. It was a pop-up project that a doc student took on as her dissertation, but I was able to help with some of the data collection and analysis. And it was a photo voice project. For those of you who may not know what photo voice is, it is a qualitative method in which you use pictures and then interview to get the qualitative rich data. And so we wanted to find out from the elderly in Southern Indiana, what were some of the factors facilitating their health, and then what were the barriers to their health. And this was back in the early 2000s when we didn't have cell phones that were digital. We didn't have digital cameras. We gave them old disposable, like actual disposable. Sorry. And my dog must be the male person. Anyway, we gave them each a camera and we gave them an assignment. And the assignment was to go take pictures on one of all the things in your life that facilitate your health. And then the other one was for barriers to their health. And then we interviewed them about some of their pictures as to why they took those. And then we disseminated it in a truly unique way. So if you'll advance to the next one. We did an art exhibit, and this was such a big deal in Southern Indiana, really rural area. We invited all the participants and their families. The mayor showed up, the fire department, or the fire marshal and his folks were there. It was a big deal for this little tiny town. And you can see in the top picture, that was the doc student working on the project, and the woman in the picture below who's staring at the camera was the public health nurse at Washington County Health Department. And so we learned some really interesting things, right? Like a picture of a ladder, and we'd say, well, why did you take a picture of a ladder? Well, because I need to go up and clean out the gutters, but I'm worried I'm gonna fall and hurt myself. Or a picture of an electrical cord and say, why is that there? Well, because I have to have a fan running, I don't have air conditioning, but I'm worried I'm gonna trip in the middle of the night when I get up to use the bathroom. So some really interesting stuff that then helped the health department in thinking through some interventions and ways in which they could try to increase the health care and access for these individuals living in Southern Indiana. And so while it was many years ago, it's still a really cool project, and the dissemination on those pictures on those boards, which I put those together, that was a very time consuming task with some of their quotes, was still one of the most, I think, interesting projects that I've been a part of. So, and I think that here's just a couple books if you're interested in learning more about CBPR. The middle book, I have a chapter that I co-authored, and it was about all the work I've done with a community organization in Atlanta, Positive Impact. And I worked with them for many years while I was a doc student, and then also when I was at OU. And it's, I think, an interesting chapter. If you want it, just let me know. I'm happy to send it to all of you. And then some other books there as well that have really good information if you're interested in CBPR. And with that, I will turn it over to whoever is next. Thank you.
Okay, thank you, everyone. And I really want to say first, again, a big thank you for everyone that is attending today's webinar. I would also like to thank Gretchen. Thank you for the opening. Excellent. And the wonderful opening. And Dr. Basta, thank you for beginning that discussion with community-based participatory research. And with that, I'll state that with the Center for Environmental and Workplace Health, we're probably on this continuum from, it depends on the research, depends on the project, from community-based research, probably to CBPR light. You know, I think the area where we probably don't get the community as involved as we can, and I think in the future we need to really look at this, is on the analyzing the data and disseminating. And I know there is some collaboration in that area, but we need to take that a step further. So I know we do disseminate the information, and I'll discuss that here in just a minute. Next slide, please. So one of our areas of research is firefighter research, and I want to talk about this just for a minute. You know, realizing that one of the things as we started this work, and we were contacted and started to work, one of our adjunct professors actually works with the Kentucky Department of Environmental Protection, and he has a close relationship with firefighters in the Northwest region near Owensboro. And so we began this process of meeting with firefighters, discussing with them, and this started all the way back in 2015, believe it or not. All the way back in 2015, we started this process of meeting with firefighters. I remember the first meeting was at Moonlight Barbecue in Owensboro, Kentucky. And so we began this process of community-based research with the firefighting community in and around Owensboro, and really an 8-county area, and it may be larger than that. Gretchen can correct me, I may be wrong on that, but okay, thank you. And it involves about 71 different fire stations. And what we started to notice as we looked at the literature and started to begin this research is that, you know, nationwide, there's about 33% career firefighters and 55% volunteer. However, in this area in Kentucky, and doing research through the Kentucky Fire Commission, in Kentucky, and because of the rural nature of Kentucky, there's about 93% volunteer firefighters. And so as we even dug deeper and started to work with Green River Firefighter Association, we noticed that, wow, most of their firefighters are volunteers. And then we started immediately, you know, in our discussions, we started going to their meetings. We noticed that, wait a minute, when they talk about training and everything and resources, it's vastly different from career to volunteer. So we saw there's this continuum of training, there's this continuum of resources, and they're vastly different for most volunteer stations as compared to career stations. And then we started digging in the research and realized that also almost all of the research with firefighters and looking at their exposures and you know, looking at carcinogens and rates of cancer, it's most all of it is with career firefighters. And so we started asking questions. Are there differences in exposures that volunteer firefighters have as compared to career firefighters due to their training and resources? And we really didn't understand that population well enough. So, you know, we started attending, as you see in the bottom left, we started attending their bi-monthly meetings, and WKU is now on the agenda. So we have an agenda spot with this group. And again, this represents an 8-county region, 71 fire departments, ranging from volunteer to career to semi-career, if you will. So they'll have a few career folks, and everybody else is volunteers. And the training, as you start to look at the training can be vastly different depending on the station, depending on whether they're career firefighters or not. And we noticed that, that this is an issue, and they were really concerned. At this time, the research from NIOSH came out showing that firefighters have 2 times greater risk of certain cancers due to their exposures on the job. And so the firefighters with Green River were very concerned. And so they began to tell us some of the issues that they faced. And we began to, over a year's period, we began to become part of their community and just understand more of what they do on a daily basis and how they operate, even before we started any type of research. So we wanted to first try to understand where they are. And then we started meeting with leadership, and you can see that top left-hand picture. We started meeting with leadership and then discussing specific research strategies. What did we want to approach? And so the first thing we did, and Gretchen, if you will, change it, Gretchen. The first thing we did a study, and we used a mixed methods approach, of course, and we did a survey trying to look at different exposure parameters and look at how their exposures might occur. So we started this, and we actually used the leadership to develop. We worked with them to develop the survey completely, because it was, we would come up with a question and we would think, oh, this is wonderful. They would read the question and be like, what in the world were you thinking? So that was, this started in 2015, and now it's 2021. I can't believe it's been 6 years. Yes, we've published research out of this, but it is at a much slower pace because we're working together. And, sometimes I'm looking at the continuum now from community engagement to total CBPR. And we are somewhere in that realm, but I think we're closer to the CBPR light because we work so closely with that community. But anyway, these are some of the studies we've done. We also did a larger firefighter association. We began working with the Dixie Firefighters Association, did a pilot exposure study there, and we added a behavioral component. Gretchen joined our team, and so we added a behavioral component. And so we've published 4 research journal articles over this time period. And we just had one paper come out in 2020. And we're looking, I know we're still working on a few papers and hopefully get those published. But the main thing here is transferring this information back to the firefighters and trying to help them understand their exposures, understand their risk, and to work safer, healthier, and improve their well-being overall. And so, we're in the middle of this, and we've done everything from hardcore studies where we actually take samples like the diesel particulate matter assessments we've done in fire stations, to actually going into vehicles and sampling for our carcinogens that are present in personal vehicles. I'll get to that in a second, and in fire trucks as well. So in future research, we already now have funding through the University of Louisville. And so we're continuing this research. And Dr. Idrissa Sanyang is going to be the PI on that. And all of our team will be working on that. But we're working with the University of Louisville, and we'll be conducting a post-COVID-19 study to look at have any of their exposure parameters or potential exposures changed as a result of COVID-19. And so we're going to be doing that research as well. So this is this is just a simple little table here, but it points to a very important factor. As we started this research and dug into the survey, and I'm not going to present all the research here, but we noticed that volunteer firefighters and career firefighters, they do different things on their job that potentially increase their exposures. For instance, and we were kind of shocked by this. We thought, you know, you look at the National Fire Protection Association, and or administration, they actually have guidelines for storing personal protective equipment. You know, they have their overhaul gear and their SCBAs they wear, all of their protection equipment. And we noticed that the volunteer firefighters, because they don't have the resources, the fire trucks, you know, they might be working as a realtor or working for the city or at a factory. And then there's a call, they get in their personal vehicle where they keep their gear and they go to the fire scene or the fire ground to fight the fire. Well, what was happening is they fight these fires, and when the gear, you know, they're wearing this gear, there's smoke, there's all these vapors, and it's a lot more intense in today's world than it used to be because the materials have changed that are in homes. There are a lot more organics that are in these materials, volatile organic compounds, and a lot of these are carcinogens. And so we noticed that a third or over, you know, about a third of the firefighters, volunteer firefighters, reported where do they carry and store their gear? In their personal vehicles. And so they fight these fires. It had these contaminants around and there's research that shows this. There's the contaminants on the gear. They take the gear and then after they fight a fire and put it in their personal vehicle. So it's off-gassing and you see these issues. So this is just one example. And we didn't have any clue about any of this until we really started working with firefighters. And, you know, another thing is how they store their gear, airtight containers. Well, that's totally against the National Fire Protection Administration's guidelines. So, you know, we're still working on a lot of these issues. And, you know, these are just a few pictures from some of the research, everything from automated collection of automated collection of direct air quality samples. So we've done research not only with Green River, but we've also expanded that and done research with a total career department here in the city of Bowling Green. So the city of Bowling Green, for example, they were concerned that they were having exposures due to their we probably could do an entire presentation on this, but they were concerned at their startup each day. So every day at 7 a.m., a new group of firefighters comes in. They're on a 24-hour shift. So they have this startup procedure. They start all their vehicles, start all their equipment. And so they were concerned that, you know, 2 of their facilities have what's called they have this system where a Plymavent system, they put the tube on the exhaust of the fire engines and it expels it outside the fire station. So we did this research thinking, you know, making a hypothesis that the station that didn't have that would have higher concentrations, and then we do the research and find that just the opposite. So what we found out is the firefighters were relying so much on that system and thought they were so protected that they would keep the doors shut when they would start all these vehicles up. And so you've got this enclosed container basically where they're starting all their vehicles. And then the fire station that realized, hey, we've got this old system, talking with their buddies and everything, they open the doors immediately and drive the trucks out to start the day. So concentration is totally different, and we found a totally different scenario in this study. But again, we worked with the city to determine how we would sample, how we would run the tests, and actually how we would collaborate. And then we, of course, presented all the research to all the chiefs and to the fire stations. So, you know, in our firefighter research, we kind of work from the point of view that we want to identify the different exposure variables, and here's how we started, but we're moving forward, evaluate their turnout gear practices for both career and volunteer firefighters, examine some of the constructs, especially related to cleaning their gear, storing their gear, and their use of PPE. And then we've done research to assess the occurrence of the polycyclic aromatic hydrocarbons in vehicles, and we've shared that information. So, and some of the other things we do, we actually have engaged with firefighters on some other activities, especially engaging our students, as you can see in this left-hand story. So one of the issues related that happens from time to time, they'll burn structures to practice fighting fires. And so we've had our students in these scenarios collaborating with firefighters, measuring contaminant levels in the downwind side of work where the firefighters work, trying to determine what potential exposures are. But anyway, just engaging our students with the firefighters, and we've been working, in the right-hand picture, we had a group of students that help administer our first round of surveys at their training school. And so just everything, we try to involve not only the community, but students in every aspect of everything we do. And, finally, we've had opportunities, and this is just one opportunity. And myself and Dr. Macy and Dr. Huang, who was here at the time, we actually participated with the Kentucky Fire Commission. And not only did we present some of our work to the GRFA, but it's expanded now. And we've had several times we've been able to be on the state platform and presenting what we have found. And in this, this was recorded and everything and shared with fire departments around the state, defending yourself from carcinogens. So this was everything from what we found in our research to methods to reduce levels on gear and other procedures. So anyway, when we formed the center, one of our things was we were right in the middle of, or we had just started this research right in the middle of it. And this was a big reason that the center was started. And as it states here, I didn't make this title, but the center's research offers practical applications, including saving lives. Well, one of the things we want to do with firefighters is do everything we can to reduce their exposures to carcinogens and improve their well-being and health. So just to transition a little bit, just to give you some examples, some other community-based research, and we've got some exciting things to report for 2021, believe it or not, trying to work remotely and still doing research. We have done research all across Kentucky, working with communities on hazardous materials transportation. And the key there is we've been working with communities across Kentucky to improve their preparedness when it comes to hazardous material incidents within their community. We've done studies starting in 2010. I can't believe it's been 11 years. So starting in 2010, we started with Warren County, Kentucky, and we worked directly with, so in this research, it's really interesting because we work with the state. We work with all three of these components of different community. They're part of this emergency management community, but we work with the state, the region, and the cities seamlessly. So when we're doing these projects. So coming this, and these projects, these commodity flow studies, what we focus on is trying to determine what hazardous materials are transported in and through counties in Kentucky. Our upcoming studies will be in Pulaski County and Laurel County, which includes Somerset and London, Kentucky. And it's about an hour, about 2 hours east of Bowling Green. So we will have studies, and I think we may have one more study in Northern Kentucky. I just got identified today, team, so just be aware. But what we do in these studies, we work with the emergency managers, and we work with there's also a local emergency planning committee. So we work with the emergency managers, the local emergency planning committee will do the study. And we do have pretty much a design on the study, but we're very flexible. We work with the emergency manager. We modify our methods to meet their needs. And then throughout the process, we do discuss with them what we're finding, our data, and then they get a report, and then we do usually a large presentation and dissemination with the committee and the basically the local community. I'll never forget one of the last large presentations we did. We thought we were going to be talking to 10 people, and Jacqueline, Miss Basham, and I show up, and there are about 95 people. So we definitely disseminate this research. And anyway, it's funded by the U.S. Department of Transportation. So just some examples here, and it may seem pretty simplistic. Yes, we do have students sitting near roadways, near railways, collecting data on the hazmats that are being transported. And we also do actual survey with the fixed facilities, and we do some data mining. We mine the databases for incidents that are maintained at the federal, state, and local levels. So this research is, the bottom line is in most regions, as you see in the bottom picture, they're practicing their response to a hazardous material release. Most jurisdictions don't have the resources nor the knowledge of what is transported. So we're trying to change that in Kentucky. We're trying to change that. One of the last things I want to show is that, another example is that we do stormwater management research, and we started this research probably back in 2008 or 9. But anyway, this research has continued until today. This has really been a lot of fun and a lot of great work. But now so what we do in this research, we help local jurisdictions, local municipalities with their stormwater management. And that's everything from sampling, doing water quality sampling, to coming up with videos, educational videos, to actually doing specific research projects on runoff and pollutants being transmitted through the environment and to the local streams. And now we're even part of their advisory council, and we meet monthly. So it's just a continual process. Yes, it's somewhere on that scale of CBPR light. And this is more environmentally focused, so it's probably more community-based, but it still involves the community and their input in all the process. And as you can see, many students. And now I could probably let Dr. Sanyang, he could do a much better job of this, but we also have a research endeavor in an international setting. And so Dr. Sanyang is going to be doing a course this next winter in Zanzibar. And not only that, we're doing research in 3 countries, and I'll let him talk about this, in Africa, looking at youth risk perception and their risk in the road environment. So that's really a big issue in areas of Africa and across, that nation, across different nations and throughout that continent. So I'll let Dr. Sanyang talk that, but we're also moving what we do to international settings. So
thank you, Dr. Taylor. Yes, indeed, we've been doing some community based participatory research, and this involves some additional people within the department, not just within the Center of Environment and Workplace Health. mostly in Gambia and Tanzania, where we work with the youths in terms of, race within the roadway environment. We also work with the police. And we've collected a good amount of data that we're currently analyzing, and soon we'll be publishing in peer-reviewed literature. Thank you.
With that, I'll turn it over to Ms. Basham.
So what I'm going to be talking about today is how we engage our students in this. We try to put students in every one of our research projects so that they can get involved, so that they can learn. We've had really great successes with even having students employed with people we partner with to do these research projects. Actually, the student, one of the students in these pictures now works for the Kentucky Department of Environmental Protection that Dr. Taylor mentioned with the firefighters. So we've had really good success with that. So I'm just going to talk a little bit about how we get our students engaged. If you'll go. So the first way we like to do this is research in the classroom. One of the things, especially with undergraduates, which I'm an instructor, so that's mainly who I work with, are undergrad students. And it's sometimes hard to get them to do research because they have so much going on. They don't really understand what research is a lot of times. They see it as this abstract concept. So one of the ways is just in the classroom, getting them involved. And so in the top picture, we were able to take students to the fire stations in Bowling Green where we were doing research. These are undergrad students. We were able to take them there and show them what we were doing, show them the part of the research and get them a hands-on approach to this, to see that, research didn't have to be this big scary thing, that it could be really manageable for them. And it also gave them the opportunity to see how a research study was set up. So they got to see the calibration processes for all our machines. They got to talk to the different fire station, the different firefighters that were there, things like that. They get to learn. In the bottom picture, you see one of our students learning about the chain of custody form. So how you are able to send samples in, which is obviously related to their jobs, but it also gets them this idea of what can I do and how can I make a difference? The other way, the municipalities we talked about, we've had so many students engage in that research. And I was lucky enough when I was a student at Western to be involved. I was able to do an undergraduate thesis through the Honors College with one of the municipalities we were working with at that time. And we've had a couple of other students do similar projects with them, have internships with them. And so some of our graduate classes will go to the municipalities. They will go down there and work with the student or work with the municipalities during class time as part of their class, as part of the projects. We've also partnered with local industries before. If you'll go to the next slide, Gretchen. We've partnered with a lot of times with local industries to do field trips. And this gets the students out of the classroom. It gets them thinking about real life, how you can apply that. The bottom picture here is at a local industry where we were able to take students. They were able to see the processes. They were able to learn about worksite health promotion and the different aspects of that. And then volunteer activities is where we have been really successful with getting students involved, getting internships for them, getting them practical experience, getting them thinking about research. The top left picture is at Household Hazardous Waste Day, which is something they do twice a year in Bowling Green. We have been able to create a partnership with the folks that host that. And so our students, we have students almost every time they host that have been able to work. With COVID, they haven't been able to have it the last 2 times, but prior to COVID, we had students almost every single time that they had that, being able to volunteer and help. Even if it's just administering a survey, they do a lot of surveys to determine why people are coming and what they're bringing, different things like that, all the way to hands-on where they are actually helping transport, they're helping move the waste, they're helping direct traffic, different things like that. And then we've also had volunteers at what's called the Progressive Agriculture Foundation Safety Day. And so we have students that talk about water safety there in that picture. And that's 2 of our students. And this is to children, I believe it's 5th or 6th graders. I can't remember exactly, but it's kids in elementary school. And so in the state of Kentucky, we have a lot of farms, we have a lot of rural areas, and this gives our students the opportunity to give back and to show these kids that, you know, they can be safe and that there are ways to do that. We taught them how to put on life jackets if they were going to be swimming, if they were going to be participating in some kind of water activity. We've also done stream cleanups with our local municipalities that we partner with. We'll go down and help with their stream cleanup that they have once a year. And that gives our opportunities for our students to meet with those municipalities. And a lot of times out of that becomes a job or a referral to another job that they know about, or an internship. If you'll go. And then the final way we really like to engage our students is with conferences. And when I say conferences, it doesn't necessarily mean that they are going to present. A lot of times we only want to take students to conferences in order to have them present. But we like to try to take our students so they can learn and they can see that they could be the one presenting. And we've had great luck with that our students will go maybe to a local conference like the Kentucky Public Health Association, and they'll see these presentations and it'll inspire them to start working on their own research so that they can be presenting. We take our students every year to the Cincinnati PRP Symposium, students that are on our scholarship program through NIOSH that Dr. Sanyang is going to talk about later. We take students there every year for that. And then we've also taken students as far as we went to Philadelphia for the American Industrial Hygiene Association's annual conference, and we're able to take students there to see the research that was being done on the national level in industrial hygiene and occupational safety and health. And with that, I'm going to turn it over to Dr. Watkins to discuss more about student engagement.
All right, thank you, Jacqueline. We're going to look at, again, how students are engaged and contribute to research and events at WKU in our department. We're very proud of our students. And the first one we're going to look at is the Tobacco-Free Initiative from the American Cancer Society grant that we got in May of 2018. This was an 18-month grant, and it was basically trying to get the campus, WKU campus, as a tobacco-free campus, get the policy implemented. And it worked. We actually got a tobacco-free campus starting a year ago, actually. And so we're very proud of those results. And we could not have done it without our students. We could not have done it without our students. One of the requirements was that 2 surveys had to be done. And we had 2 graduate students that did the observational study, which was a pre and a post, to look at the campus and see what the behaviors were on campus as tobacco use. And then also a student survey email was managed by a graduate student. And this purpose was to gather the opinions on tobacco-free policies on our campus. And again, that had to be a pre and a post. So we had our students that helped us with those 2 surveys. We also had events during this grant, and the events were basically, I would say 99% of it was students. And we were very proud of what they did. A huge contributor was the Kentucky Public Health Association students that Jacqueline mentioned earlier. And I'll have to brag on them because for the past probably 12 years, most every year we were the #1 student organization in the state. And we were very proud of that. And our students have always contributed significantly to all events on campus that would promote health and promote public health. We had to have task force meetings. We always had 2 graduate students that would attend those. And they were there was 25 people from across the campus that came, and from administration and all different areas to represent, to try to get this initiative for a tobacco-free campus through. So we would have meetings every month about that. And 2 of our grad students would come. They would take the minutes. They just really contributed to that effort. And from that task force meeting, we broke into certain subcommittees. And one of those was a marketing meetings that we had about every month also. And that marketing meeting, to be honest, was one of the most successful subcommittees that we had, because they really got the information out there, and everybody was communicated with very well. And I think it was a very successful effort from marketing. We're going to show some pictures here in a second also of some of these. Tobacco Free Tuesday, KPHA students handed out mugs, and Tobacco Free Campus petition was signed. Healthy Days, where KPHA students handed out t-shirts, stress balls, different things to help promote tobacco-free campus. We had, and these pictures are going to be amazing when you see these, we had Kick Butt Day. And again, KPHA students and over 100 other students from across campus picked up 10 pounds of cigarette butts and handed out t-shirts, and also had the petition signed. So those were some very successful events that helped to promote this initiative. At 2 homecomings, we had KPHA students that was, and I'll show you the picture of that, was also promoting tobacco-free campus. We had a walking tour for signage to see where signage would be most effective with. And we had our grad student come along with that and record what had happened during that walking tour. And then for 2 years, we had to attend an Atlanta grantee conference in Atlanta, Georgia, that where we listened to other campuses, other universities, and what they had done in their initiative. And each time that I went, I took a grad student with me, and I think it was a very good experience for them also. And here's those the visuals that I was talking about. This was Tobacco Free Tuesday, and it was in 2019. And one of the main drives on this one was to get the petition signed to show support for tobacco-free campus. And again, our students gave out mugs and hot chocolate, and it was cold at that time, so it was very well attended. I think we ran out of mugs in no time. It was amazing how quick we ran out of what we needed. So it was very popular. And this was the one I was talking about that had the great visuals. If you can, this was Kick Butts Day, and this was February 2019 event. And as I said, there was 10 pounds of butts that were picked up. We had students from campus-wide that came and did this. A lot of them were in public health classes that offered extra credit for them to do that. And so they contributed in that way. But until you've actually dealt with this, it was so big and it stunk so bad. And it was just amazing that that there was that much in that short a time. It was only, I think, 4 hours that they did this, and it filled up rather quickly. So that shows the problems that you can have when you have smoking on a campus. And the 2018 and 2019 homecoming, this was, again, a great marketing time. They signed petitions. They played spin the wheel. And when they spin that wheel, they had to answer a question about tobacco use. And if they answered the question correctly, which they normally always did, they would get a t-shirt or a water bottle or whatever it was that we were giving away at that time. And this was well attended. We actually had Big Red come, and we had a lot of participation at this event. That was our tobacco-free grant. I'm going to move over to the total worker health research that we had. This is the last thing I'm going to touch on with student engagement. We had a NIOSH grant that we got in 2017. And this grant was, the purpose of it was to study barriers of integration of health protection, which is safety and health promotion in rural workplaces, and also to have tailored interventions that would address the identified barriers. And it was very interesting that we went to local industries, and basically we had 2 undergrad students, and a lot of times it's harder to get the undergrad students involved in research. So we were really excited to have these 2 undergrad students that wanted to be part of this research. They assisted with interviews at 3 of the workplaces that we went to, and actually recorded and logged everything that was said and done in those interviews. They assisted with data analysis, and because of that, we acknowledged them in our publication of the study in the Journal of Occupational and Environmental Medicine in 2018. So we were really excited, Dr. Macy and I were really excited that we could do that, because they definitely contributed to that research. And I think they learned a lot. In fact, one of those students is now works in worksite health promotion in Florida, and she's done very well. Very proud of her. The second one was our NIOSH grant of 2019. Dr. Macy got this grant. We had 1 graduate student that assisted in data collection for this grant. It was basically a statewide, Kentucky statewide survey that comparison of workplace health promotion and occupational safety and health programs, compared that to a national survey and to a previous survey that we had done in Kentucky in 2014. And so with the help of this graduate assistant, it made our lives more manageable to be able to help with the data collection. And again, learning a lot of research methods and data analysis in the process of doing that. So again, I just want to brag on our students. I think they're just so important and so critical to what we do here at WKU. And now I'm going to turn it over to Dr. Sanya.
Thank you so much, Dr. Watkins. And thank you, colleagues, for the wonderful presentation. Most of those successes, I must comment, are possible because of the continuing support we get from NIAS in terms of the NIAS TPG grant. Next slide, please. Yeah, NIAS, we understand, is an arm of CDC, and the major objective is to ensure that the US population's health is definitely protected. It was mandated by the 1970 OSA Act to provide training and research in occupational safety and health. Over the past few decades, from the 1970s or even earlier to even the recent time, there has been continuous challenge in terms of workplace health and injuries. And in 2011, NIAS decided to conduct a nationwide assessment of occupational safety and health needs. One of the major findings of the assessment was a massive shortfall in terms of professionals in the field or even researchers in the field. And from there on, they started to provide a lot of training opportunities to different centers in different disciplines across the country. Next slide. So as can be seen in the map, you have a lot of training project grants. We call them the TPGs across the country. Most of them, of course, concentrated in the East Coast, but we have them in the areas of occupational safety, in the areas of industrial hygiene, also allied occupational safety and health, and occupational medicine. Within our region, that is within Kentucky, fortunately, we have 2 universities that are participating in this grant. That is our own WKU, where our focus is on allied occupational safety and health, but we also have a sister university, Moreland State University, that focuses on occupational safety. Our program got funding in 2 areas. We get support our BS in EOHS program. We also get the MS EOHS program. These are very competitive scholarships that we give out to students. Most importantly, they have to be US citizens or permanent residents. And also they have to be fully admitted into the WKU EOHS programs. And, but this I would mention here would exclude the certificate programs that we have, within the department or in the college. But also each of the scholarship recipients must have at least a GPA of 3 or better. For students to continue to benefit from the NIAS TPG grant, they must maintain a GPA of 3 or better. And on every semester, they must have at least about 9 credit hours for graduate and 12 credit hours for undergraduate. And the additional conditions we also have is to ensure that students participate in the center's research or activities. They would also be required to attend presentations, workshops, or conferences. I'll talk about the funding modalities just in a bit, but these are the conditions that students would definitely have to meet to have that continuous funding support. Our mandate is to ensure that our training emphasizes a couple of areas, mainly exposure science in the mainstream environment, but also in the occupational safety area. So looking at safety in the industry, looking at environmental compliance, industrial hygiene, and researches in any of these domains are also emphasized in our training. Financially, the grant provides support in terms of tuition. We also provide stipend for living expenses for students. We provide support to students and faculty to attend conferences. And also, but most importantly, every semester we do invite a guest speaker who will talk on specific competencies that are definitely important, or some new innovations in the field, that would benefit both the faculty and students. So that is also supported from the grant. Our output has been impressive. I would say for certain, we have trained over 60 students from the program, and they are in different roles, most of which are managerial roles, from safety managers, safety officers, and all the other safety roles, but also a couple of students or graduates from the program are in the environmental compliance, also in the research areas as well. And some of them even are working with the US Army. But also importantly to NIAS is to ensure that we have that continuous capacities in terms of research. So a couple of our students have also get admissions into doctoral programs, to do advanced trainings in exposure science, and also to do research and be future researchers as well. The need, like in the first slide or two, like I mentioned, in terms of providing professionals for the field, is still a major challenge. If you go to indeed.com today and search occupational safety and health, within Western Kentucky and Nashville area, you would definitely pull over 60 vacancies. So that is the market we are competing to fill, and is definitely a very lucrative occupation, because most of our students entry-level jobs, they would score about 45 to 50, 60,000. But on average, some of them would score, 75 to 90,000 per year. Thank you. And then just to emphasize that the principal investigator for the grant is Dr. Richie Taylor. He has been supported by Dr. Gretchen Massey, myself, Dr. Watkins, and Ms. Parson as other investigators.
Yes, and I can say without a team, the center, we wouldn't have the center. So we have an incredible team, and I give all the credit to them for the grant and everything. So I think that's the key, is that any type of center like this, we have to have a collaborating team that's willing to fulfill different roles on different research projects. And you know, my personal goal in this is that just to see the success of my colleagues and the students, and to help the community. So anyway, as director of the center, I appreciate that.
Okay, thank you. I know we're a little bit over on time. Joellen, were there any burning questions that we can answer before we depart?
No questions.
Okay. All right. Well, thank you to all of our panelists. That was very enlightening, and I think we could probably have another entire session on each of your individual research areas, but certainly we could have another community engaged research presentation, if not workshop too. So I look forward to see what we can all do in the future. And certainly we are very proud of your center and all the work that you've done. The firefighter research is really, really interesting, as is everything that was presented today. And of course, providing those opportunities for our students is invaluable. So I appreciate everything you all do, and I hope everybody stays warm and has a good weekend. So thank you.
Yeah.